Hey guys, this is Dr. Hub. Today we'll look at the arrangement. So we're looking at the arrangement of the cranial nerve nuclei. And this will be in the brainstem. So to begin with, what about the functional component of the general somatic efferent? So the functional component of the general somatic efferent. So this is the SE and the GSE. So what is the cranial nerve associated here? It is a 3, 4, 6 as well as 12. Next we move on to the special visceral efferent. So there is a special visceral efferent. So special visceral efferent is nothing but there is SVE as well as a BRE. So what is the cranial nerve associated here? It will be the 5, 7, 9, 10 as well as 11. So it is 9, 10, 11 and 5, 7. Then we move on to the GVE. There is a general visceral efferent, and the general visceral efferent is the 3, 7, 9 and 10. So it is 3, 7, 9. So odd number, the 3, then comes 7, the 9 as well as 10. Then we move on to the general visceral efferent. So general visceral efferent, we are writing it as the GVA. So the general visceral efferent is nothing but the 7, 9, 10. So it is 7, 9 as well as 10. Then when you are looking at the special visceral efferent, that's a BRA. Here it is again the 7, 9 and 10. Then moving on to the general somatic efferent. So general somatic efferent is nothing but the SA, GSA. So here it is nothing but the 5, 7, 9 and 10. Then comes the special somatic efferent. The special somatic efferent. The special somatic efferent is nothing but the SSA. It is nothing but the cranial nerve 2 and 8. So other thing to note is that the GVE, that is a general visceral efferent. It represents the parasympathetic supply. So it represents the parasympathetic supply. So all cranial nerves having the parasympathetic fibers, they have this component. What is this component? That is a GVE component. So let's understand this better with a diagram. So we have the midbrain. Next we have the presence of pons, and then we have the medulla oblongata. So under the GSE, what do we have? So under GSE, let's partition this. So under GSE, there comes a 3 and 4, and under the pons, under GSE, there is a 6, and medulla oblongata, there is going to be a 12. Then moving on to the SVE. Under SVE, under pons, there is going to be 5 and 7. And the medulla oblongata, there is going to be 9, 10, 11. That is a nucleus ambiguous. Then we move on to the GVE. So under GVE, there is 3. There is also the presence of the salivary nuclei. And under the medulla oblongata, there is the presence of the dorsal nucleus of the vagus. There is dorsal nucleus of the vagus, DNV, and this includes the 10. Then moving on to the GVA. So the GVA as well as the SVA. So under GVA, SVA, the medulla oblongata, it has presence of the 7, 9 and 10. So 7, 9, 10, there is presence of the nucleus of tractus solitarius. Then we move on to the GSA. So what is the GSA? So under GSA, there is a 5th, there is a mesocephalic. Then comes the 5, the pons, that is the chief sensory. Next is, there is again 5, that is a spinal, as well as presence of the 7, 9 and 10. On the other hand, there is also the SSA. So under this there is the vestibular nucleus, and the cochlear nucleus. The cochlear nucleus, it again is, there is a dorsal part as well as the presence of the ventral part.